Learning to sense the signals of your body can save your life. Do you know if you have symptoms of ovarian or breast cancer? There's no standard screening test for these conditions, so more than 60% of patients are diagnosed after their cancer has already spread, and when their chances of surviving next 5 years are less than 30%. There are over 200 different types of cancer that cause many different symptoms. Sometimes symptoms are associated with certain types of cancer in women, but many of them are general, like weight loss, constant fatigue, or pain. You don't have to know all the signs and symptoms of cancer by heart, but to give an idea of what should alert you, we have chosen the most important ones, regardless of gender. Often these symptoms indicate something much less dangerous, but if it's cancer, early diagnosing can save your life. Before we move on, make sure to subscribe to the channel to watch the new episodes on Big Progress. We're doing our best to create interesting content for you. Common symptoms of cancer. Pain with no cause. Pain is one of the ways the body tells you that something is wrong. As we get older, we experience more pain, but strange, sudden pain may be a sign of a serious condition. Excessive night sweats. Night sweats can be caused by infections or may be a side effect of certain medications. It's also common in women during menopause. However, excessive night sweats can also be a sign of cancer. Sudden weight loss. Small changes in weight from time to time are normal, but if you have suddenly lost a few kilos of weight without intention, be sure to visit your doctor. Strange lump or swelling. Any lump or swelling in any part of the body should be taken seriously. This includes any neoplasms in the neck, armpits, stomach, groin, chest, or testicles. Fatigue. There are many reasons why you may feel more tired than usual, especially if you're going through a stressful event or have some trouble with sleeping. But if you feel tired for no reason, it means that something is wrong, so make an appointment with your doctor. Changes in skin. The skin regenerates very quickly, and any damage done to it usually heals within a week or so. When a spot, wart, or sore doesn't go away, show it to the doctor. Even if it causes no pain, loss of skin regeneration properties is a warning signal of oncology. Appearance or changes of birthmarks. Most birthmarks are harmless, but pay attention if one of them changes size, shape, color, becomes hard, begins to itch, hurt, bleed, or leak. Symptoms affecting food intake. Difficult swallowing. Certain medical procedures can make swallowing difficult, but if you have trouble swallowing without any medical intervention, be sure to talk to your doctor. Frequent heartburn or indigestion. It's normal to feel mild discomfort after eating fatty or spicy foods, but if you have painful heartburn or upset stomach frequently, you should visit your doctor. Symptoms affecting your voice and breathing. Hoarseness. This may be common in case of colds, but the hoarseness that doesn't go away on its own deserves a doctor's attention. Persistent cough. Cough is common in colds and some other diseases, but if you cough for several weeks or if it gets worse, then it may be a sign of cancer. Shortness of breath. It's alright to experience mild shortness of breath from time to time after exercise, but if you notice that you feel short of breath more often or during rest, speak about it with your doctor. Changes in the excretory system. Be sure to tell your doctor if you notice changes in bowel movements, get trouble urinating, or if there's blood in your urine or stool. Many various diseases can cause all of these symptoms, but it's better to check them out anyway. Sudden bleedings. Despite the fact that bleeding without a cause is usually a symptom of something much less serious than cancer, you should always tell your doctor about it. Sores in the mouth that don't go away. Sores in your mouth may appear when you have colds or when you're exhausted, and they usually go away in about 2 weeks. But an ulcer, a red or white spot on the oral mucosa that does not heal within a month, should be shown to the doctor or dentist. Changes in breast. Lumps are not the only breast changes that you should tell your doctor about. Changes in size, shape, or sensation, as well as any skin changes, redness, or chest pain, are also reasons to worry. And don't forget about any changes in the nipples, for example, blood-like fluid leaking from the nipple, which is a bad sign if you're not pregnant or breastfeeding. Breast cancer is most common in women, but it's important to tell your doctor about any unusual symptoms regardless of your gender. Important signs of cancer in women. Usually women are more careful than men when it comes to their own health, but even many women ignore possible symptoms of cancer. If any of these health problems arise, please check it immediately. The sooner a specialist consultation is received, the sooner the proper treatment can be started. Remember that many forms of cancer can be cured if detected in time. Studies show that no matter how well people know their bodies, Most of them are unaware of symptoms of ovarian, cervical, or breast cancer. The absence of severe symptoms or ignoring them can prevent a woman from receiving medical care that could save her life. But why are so many of us unaware of cancers that affect only women? One of the reasons is just shame. People don't like talking on sensitive topics, and oncology surely is one of them. And genital cancer, of course, is not the most frequent topic of conversation. Unawareness. The warning signs of gynecologic cancers can be vague and similar to those of other conditions. That's why it's important to know what to look for. Cancer may not be on your radar, especially if you're relatively young and healthy, but it should be, regardless of your age and family history. Each year, nearly 90,000 women in the United States are diagnosed with a gynecologic cancer, such as endometrial, also known as uterine cancer, ovarian cancer, or cervical cancer. More than 242,000 women are diagnosed with breast cancer. Most of these cancers occur in women after menopause. However, gynecologic cancers can strike women before menopause too. Your risk for all cancer types rises as you age, but it's important to know what to look for at any age, says Dora Rainey, medical director of the Cancer Prevention Center. That way, if symptoms appear, you can tell your doctor right away. The signs of cancer, particularly gynecologic cancers, can be vague and similar to those of other conditions. Only breast and cervical cancers can be detected through screening, so recognizing these symptoms and talking about them with your gynecologist or primary care doctor can increase your odds of finding cancer early when it's most treatable. Unexplained weight loss. If you're overweight or obese, losing weight by exercising and making healthier food choices can actually help curb your cancer risk. But if you suddenly lose more than 10 pounds without changing your diet or exercise habits, talk to your doctor. Stomach bloating. Many women consider stomach bloating to be a normal part of their menstrual cycle. But if bloating occurs every day and lasts for several weeks, consult about it with your doctor. Signs of ovarian cancer include bloating and other digestive problems like abdominal or pelvic pain, lack of appetite, and frequent urination. Your doctor may run CT scan and blood tests to diagnose the disease. Breast or nipple changes. Most breast cancers are detected by women themselves during routine daily activities like bathing, shaving, or even scratching. A lump doesn't mean you have breast cancer, but get a new one checked out, especially if it sticks around for longer than a couple of weeks. Other symptoms to watch out for include a swollen breast, with or without a lump in your armpit or collarbone, nipple discharge, either bloody or clear, nipples that point inward, skin that looks like an orange peel, dimpling, breast or nipple pain, red, itchy or thick nipple or breast skin. Some experts think it's a good idea to check your breasts and underarms once a month. Your doctor can help you decide if that's right for you. They'll also tell you how often you need a mammogram. That's an X-ray that looks for changes in your breast tissue. Non-menstrual bleeding. Bloody, dark, or smelly discharge is usually a sign of infection, but sometimes it's a warning sign of cervical, vaginal, or endometrial cancer. Many women also ignore gastrointestinal bleeding, which can be mistaken for menstrual bleeding. Gastrointestinal bleeding can be a sign of colorectal cancer. Tell your doctor if you're spotting between your periods or have a bloody, smelly discharge. If you've gone through menopause, see your doctor right away if you're bleeding. That's never normal. Skin changes. Skin cancer is the most common type of cancer. Moles and birthmarks that change in shape or color are a reason to visit your doctor. Abdominal pain and depression. Depression that goes in tandem with abdominal pain can be a symptom of pancreatic cancer. The link is not entirely clear, but the pancreas is kind of an unusual organ. If you find these symptoms, tell your doctor to run the tests for cancer. Changes in the lymph nodes. Enlarged lymph nodes or lumps in the areas of armpits or neck can be signs of cancer. If the tumor grows and lasts for more than a month, see your doctor. It could be caused by an infection, but it also could be a sign of cancer. Frequent infections. Maybe you notice that you're taking insane amounts of pain relievers or antipyretics. Of course, it damages your liver. Moreover, if you take medication without knowing the reason of the body temperature rise, it will not help your body. Frequent fevers and infections can be first signs of leukemia or lymphoma, which weaken the immune system and make you more susceptible to minor illnesses. If you have one cold right after another, be sure to tell the doctor about your concerns. Changes in genitals. itching, burning, pain, or soreness of the vulva, as well as changes in the color of the skin in the area, such as rashes or warts, may be the signs of vulvar cancer. Can cancer cause weight gain? Several factors can cause women with cancer to gain weight. Tumors are the major cause. Ovarian tumors are buried deep within the abdomen. They often are not discovered until they're relatively large. They can cause some abdominal discomfort in the early stages of ovarian cancer, but can be mistaken for stomach ache or another non-threatening condition. Tumors grow and cancer spreads, taking up more space inside the uterus if left untreated. Tumors can grow quite large before causing symptoms. This is because the uterus is designed to hold a fetus. Deposits of cancerous cells, 2 centimeters or more, are often found in the abdomen during stage 3C of ovarian cancer. Having one or more of these symptoms should not scare you, but if they last for 2 weeks or more, see your doctor to check yourself. Do not ignore the possible symptoms of cancer. Thus, you will prevent or slow down its development and so live a long and happy life. That's all we wanted to tell you today. On this channel, you will find videos about the benefits of different foods, about diseases and effective methods of their treatment, as well as interesting information about housekeeping and gardening. So make sure to subscribe to Big Progress and ring the bell. Click the like button under the video and share it with your family and friends. See you soon!